Hello, I'm Tony DeMaria, the editor of JACC, here with some of the highlights from the September 4th issue. The new procedure of transcatheter aortic valve replacement has captured the imagination of the cardiovascular community. One of the issues that's recently come up is whether differences exist in the outcome from Tavr between the sexes. Now, suggestive data has already been put forward from the Partner 1 trial demonstrating a greater benefit of Tavr than aortic valve replacement in women. And the question was this due to Tavr or surgery? And so in a paper we have in Press and JACC, investigators from Canada analyzed 641 patients undergoing Tavr in Canada, looking for differences between men and women. The odds ratio for 2-year all-cause mortality was 0.6 in women as compared to men, a 40% reduction. Now, men and women differed in the severity of disease, the presence of comorbidities, and the existence of complications, so that these data certainly are not definitive. Nevertheless, if you take these data and you combine them with the early demonstration from Partner 1, it does appear that Tavr results seem to be even better in women than in men. Prior studies have shown that myocardial fibrosis, as evidenced by late gadolinium enhancement on MRI studies in patients with hypertrophic cardiomyopathy, is associated with left ventricular dysfunction and a worse prognosis. Little is known, however, about the rate of progression of fibrosis. And so a group of investigators who've published in JACC studied the rate of progression of fibrosis by late gadolinium enhancement in 55 hypertrophic cardiomyopathy patients who had an MRI examination an average of 2 years apart, had 2 MRI examinations an average of 2 years apart. Now, the percentage of patients with late gadolinium enhancement increased dramatically in this 2-year period. The presence of any LGE going from 82% at baseline to 96% of the patients at 2 years, and doubling from 13 to 25 grams of myocardium during that interval. And not surprisingly, patients with worse New York Heart Association classification increased fibrosis to the greatest extent. So the results of these studies indicate clearly that fibrosis increases very rapidly in patients with hypertrophic cardiomyopathy, is associated with worse clinical status, and seems to be a bit worse in patients with the apical hypertrophic variety. Patients with vasospastic angina can have ventricular arrhythmias that result in either cardiopulmonary arrest or death. However, the role and association of ICDs in spasm patients remains uncertain, and it's clearly not a very, very commonly encountered problem. Nevertheless, the group of investigators who published in our latest issue of JACC managed to examine the course of 23 patients treated with an internal cardioverter defibrillator for vasospastic angina. Now, each of these patients had a serious life-threatening ventricular arrhythmia. During a median follow-up period of 2 years, 5 of these patients had another episode of ventricular fibrillation or arrest. Unfortunately, there were no distinguishing characteristics of these patients who experienced the subsequent event, and so no predictors could be identified. Nevertheless, on the basis of this very interesting group of patients, it's clear that in patients with vasospastic angina who have received ICDs for life-threatening ventricular arrhythmias, one can expect frequent recurrences, and so they should be monitored closely and treated very, very aggressively with appropriate medical therapy. So again, we have our September 4th issue of JACC jam-packed with clinically relevant articles. For Inside JACC, I'm Tony DeMaria.